Hypertension Awareness Series Episode 17. What we have learned so far and where we are going next. We have learned the basics of hypertension. We are now halfway through the series. We have learned about the foundation and now we will be shifting gear to management. But before we move to management, it's important to recap what we have learned so far so that we are all on the same page. We started by learning what hypertension is. Hypertension is persistently elevated blood pressure above 140/90, measured on correctly on repeated episodes. We also learned that over time hypertension affects organs. It causes strain on the heart, on the brain, kidneys, eyes, and blood vessels. We learned how to measure BP correctly and the various stages of hypertension. We learned another key important concept, that hypertension is often silent. Most people feel completely normal until they are not and present with complications. That is why hypertension is called the silent killer, and many people are diagnosed only after complications occur. Another important thing we learned is white coat versus masked hypertension. Not every clinic BP reading tells the whole story. We learned white coat hypertension is when BP is high in the clinic but normal at home. Masked hypertension, BP is normal in the clinic but elevated at home or at work, and that is why home BP monitoring is essential. We had a week where we covered hypertension in the young, elevated BP below 40 years, and we said in hypertension in the young, you must always screen for secondary causes: kidney disease, hormonal disorders, thyroid disorder, renal artery narrowing, obstructive sleep apnea, and finding the cause can completely change treatment. From there, we move to cardiovascular risk factors, where we learned about non-modifiable factors you cannot do anything about: genetics, your family history, your gender. And then we learned modifiable that are in your control. Things like salt intake, smoking, stress, unhealthy diet, excess alcohol. We learned a key concept: genetics load the gun, but your lifestyle pulls the trigger. Genetics load the gun, but lifestyle pulls the trigger. From there, we moved to hypertension is not just a number. It affects the organ. Hypertension mediated organ damage. It affects the heart, where you can have heart failure, arrhythmias, brain, stroke and memory loss, eyes, where you can have retinopathy, blood vessels, we talked of erectile dysfunction, nervous system, peripheral neuropathy. And we said we treat to prevent complications. From there, we said the importance of proper evaluation, the test that every person with hypertension needs to get done: the kidney assessment, the urinalysis, kidney function, screen for diabetes, screen for the cholesterol, and ECG echo for the heart, eye examination. We said those tests need to be done at baseline or as soon as finances allow. We learned that we should not be BP centric, focusing on the BP numbers alone without assessing the overall cardiovascular risk factors and also the target organ damage. We are now halfway through this series, and next we move to the management of hypertension. And from the feedback I have gotten, we will shift gears. Management will be covered in two parts. Part one will be the technical part to the healthcare providers, where we'll talk of all the medical jargon, and part two will be a simplified part on management to the general public and all who stay with hypertension. One thing we are stressing in this awareness series is that hypertension is preventable. And once you have hypertension, proper evaluation, proper follow-up, you can live full and healthy lives with hypertension. And the overall goal of hypertension has no symptoms. Hypertension is a silent killer. We treat hypertension to prevent complications. So stay tuned. Do not miss the next interesting part that is coming. And as usual, Dr. Muthui-Mutua, saving lives one heart at a time.